Hello, and welcome to this informational video on the socioeconomic determinants and healthcare access barriers of Alzheimer's disease. This video is meant to be used as an educational tool for healthcare providers of Alzheimer's disease patients. We'll be talking about the most significant socioeconomic determinants of Alzheimer's disease, healthcare access barriers, and some potential solutions. So let's get into it. As with health in general, socioeconomic status is a determinant of Alzheimer's disease. As with many other diseases, racial and ethnic disparities for the risk of developing Alzheimer's disease and other dementias have been found, with Black and Hispanic Americans having a higher risk than their white counterparts. This is such a strong difference that it persisted even after adjusting for non-socioeconomic factors. Yet it was eliminated after also adjusting for socioeconomic status. This tells us just how strong of determinants race and ethnicity and socioeconomic status are. However, still other determinants have been identified. Lower educational attainment, rural residence, low income, or occupational characteristics such as toxic exposures and stress, low levels of social integration, and poverty have all been found to be associated with a greater risk of cognitive decline. Now, although these aren't specific to Alzheimer's disease or dementia per se, keep in mind that cognitive decline most often precedes Alzheimer's disease and other dementias. In other words, these determinants listed are associated with major precursor to dementias. Now, keeping it in perspective, we do have to keep in mind the old adage, association is not causation. But this also isn't reason to dismiss these associations. Rather, it's reason for further research to determine the cause and effect relationship between the determinants and Alzheimer's disease and other dementias. Also, as you probably already figured out, it can be difficult, if not impossible, to determine the exact cause and effect relationship of these socioeconomic factors, as they are largely tied together. For instance, having greater income affords one better access to education, access to healthcare, access to health promoting activities, and options for less hazardous occupations, just as having better education and access to healthcare improves one's ability to obtain better income. Now, of course, we cannot also forget about the historical, cultural, and other contexts of race and ethnicity and how those can tie into the socioeconomics. So what do we do with all this? Well, while the relationship between these risk factors and Alzheimer's disease are being researched, healthcare providers should stay up to date on the latest research and err on that side of caution by avoiding or mitigating these risk factors as much as possible to lower your patient's risk of developing or worsening Alzheimer's disease or other dementias. And we'll be talking about how to do that soon. For now, let's talk about the most significant healthcare access barriers faced by Alzheimer's disease patients. There haven't been very many studies looking into this. However, the findings among them are relatively consistent. It's still not known which ones are the most significant, yet many have been identified. Now, as with socioeconomic determinants, race and ethnicity are closely associated with access to healthcare and the quality of care received. Unfortunately, it is the same pattern as found with socioeconomic determinants, with Black and Hispanic Americans having more barriers to healthcare than their white counterparts. For example, a 2021 study by Chen and colleagues found that same pattern of racial and ethnic disparity in preventable hospitalizations and access to accountable care organizations. Another important disparity in the quality of care between minority ethnicities and their white counterparts is participation in clinical trials, with minorities having much less participation in clinical trials than their white counterparts. This may significantly affect the efficacy of new drugs in development and must be addressed to adequately reduce the disparities in access to quality healthcare. Many other barriers identified among minorities have been identified as well. So when it comes to other common barriers among ethnic minorities, the following have been found: lacking information about dementia, preconceived ideas stemming from that lack of information, such as viewing symptoms as a normal part of the aging process, lack of awareness of or familiarity with available services, language barriers, as with healthcare in general, and healthcare providers' lack of dementia knowledge. Unfortunately, that is real. Continuing on, there's also a lack of choice in formal support services. Various problems with available formal support services, including a lack of cultural awareness and diversity, geographical distance, and dispersion of good services available to minority patients. In other words, the services that are available are either too far and far between, and or are lacking the necessary cultural awareness and diversity in the service providers necessary to understand the patients that they serve. As well as denial and concealment of symptoms due to associated cultural stigma about dementia and mental illness. This is something important that should be addressed before symptoms begin by educating the patient population, especially as they approach the ages that are at greater risk of developing Alzheimer's disease and other dementias. And lastly, there's cultural difficulty or unacceptability of having a stranger entering the home or having a stranger helping with personal or other forms of care. Cultural or community expectations of family members being caregivers rather than formal caregivers. Cultural perceptions of institutionalized racism, negative beliefs about Western medicine, and folk beliefs about health and aging. Now, this last point, that's all encompassed when we mention cultural beliefs and attitudes. Now, knowing the exact causes of these disparities in accessing healthcare can be complicated and difficult to ascertain. Yet it may not be completely necessary in order to address the barriers and provide better care to Alzheimer's patients and their families. We'll talk about that soon. For now, let's talk more about barriers to accessing healthcare, especially how they break down among patients and caregivers. And when it comes to barriers to accessing healthcare by informal caregivers, the following barriers have been identified: a lack of knowledge and information about dementia, commonly held negative attitudes and beliefs about formal caregiving, a perceived lack of need for formal care, especially in early disease stages when symptoms are less severe and more manageable. Feelings of obligation to care for an ill loved one, and perceiving formal care as either interfering with that obligation or as a failure of the informal caregiver's care. Continuing on, there's also fear of losing control if formal care is used, which ties in with feelings of obligation to care for an ill loved one, discomfort with having strangers in their private homes, and of course, not having the money to pay for formal services. So those are the barriers among informal caregivers. Now let's turn to patients. When it comes to barriers to accessing healthcare by dementia patients, the following have been identified: their attitudes and beliefs about the disease and formal care, which may be negative or positive. For example, they may believe that a diagnosis of Alzheimer's disease or another dementia is not that big of a deal, or a normal part of aging, or perhaps treatable. Something, perhaps some erroneously positive thoughts. On the other hand, they may have negative attitudes or beliefs about formal care, such as invading privacy without providing any real help. Now, tied in with this point is a lack of information about the disease and services available. There's also emotions surrounding the diagnosis and adaptation process. Remember those 5 stages of grief: denial, anger, bargaining, depression, and acceptance? Well, just play a role here too. Perceptions of formal care as a threat to their independence. Yes, this is true even amongst minority cultures as well. So those are the barriers amongst patients. Now let's turn to the barriers when it comes to formal services and caregivers. The following have been identified. Poor service or care that discourages further use of formal care services. The cost of formal care services may be prohibitive. Negative attitudes and beliefs about dementia or people with dementia. And this is something healthcare providers should be acutely aware of amongst themselves. A lack of available services, a lack of staff, a lack of sufficient financing of the services, which all kind of are tied together. Having a complex system of services, whether that means having access to different services, having to access different services to obtain the adequate level of care, or having to go through complicated insurance policies or other such issues. Discontinuous service and care. For example, maybe having a new nurse or home health attendant or other caregiver coming in every day. So you got a new one coming in every day, with each one having to learn the specifics of a single patient every day. You can see how this could be a real barrier. And lastly, inconsistent or insufficient dementia knowledge among general practitioner doctors. Again, something to be acutely aware of as healthcare providers. So those are the barriers among formal services and caregivers. That was a lot of information about barriers to accessing healthcare. So let's sum them up. Some of the many barriers may not be what you thought when barriers to accessing healthcare were first mentioned. You also probably noticed that quite a few of the barriers are tied together and common among more than one group. Also, as you probably already figured out, some of the barriers are out of the control of healthcare providers, like financial limitations and how the system of services are set up. Still, there are many other barriers that you can do something about. So now let's talk about some of those solutions I keep mentioning. Here, it's important to note that potential solutions for the identified socioeconomic determinants of Alzheimer's and other dementias have not been developed and researched to the same extent that the determinants and barriers themselves have. However, there are a few that have been identified that are relevant to healthcare providers. And of course, there is still basic logic and common sense. For example, you can prevent healthcare provider lack of knowledge about dementia by learning more about dementia, and you can help prevent or reduce patient and caregiver lack of information about dementia by providing them with more information about the disease and available services. Just obvious common sense stuff. Now, among the identified and proposed solutions for the socioeconomic determinants, we have cultural competency training. This involves learning about the cultures of your patient population to learn about their attitudes and beliefs about aging and dementia, and to ultimately improve your communication and care. Next, we have outreach to minority communities. So this involves going out into the communities you serve and engaging with them. Now, the engagement can take many forms, such as hosting health fairs and having presentations at community centers and other forms. You can get kind of creative here and use resources already available to tailor your approach to the community you serve. Using less culturally dependent cognitive screening tests, like the mini-cog and other such culturally less dependent screening tests over other more involved and culturally dependent screening tests. Also, it's important to note here, the mini-cog test doesn't need to be licensed if it's being used by healthcare providers to provide healthcare. And lastly, we have improving the overall health and reducing the modifiable risk factors other than education and wealth resources, possibly being one very important way to reduce the gap in dementia risk between different socioeconomic groups. So just taking the best possible care of all your patients and educating them about the modifiable risk factors that they can change is an important additional way that healthcare providers can reduce their patients' risk of dementia, regardless of socioeconomic status. That's an important point. So remember, we said regardless, we're addressing the modifiable risk factors other than education and wealth. Now, these potential solutions for the socioeconomic determinants tie in directly with removing barriers to accessing healthcare by Alzheimer's disease patients. For example, community outreach can involve informing community members about Alzheimer's disease and other dementias, a common barrier among patients and caregivers. Also, the solution of cultural competency training ties in with solving the healthcare access barrier of language barriers. Part of being culturally competent is knowing what language people from different cultures speak, which allows you to employ the necessary language services needed to effectively communicate with your patient population, thus helping them to access the healthcare they need more easily. So, by beginning to address the socioeconomic determinants, you will also begin to address the barriers to accessing healthcare. This is good news. It means you, as a healthcare provider, don't have to worry about changing the entire social or economic systems to address the socioeconomic and dementia risk of different segments of society and effect a positive change in the community you serve, regardless of the socioeconomics. Let's sum up what we learned here in this video. First, there are significant and racial ethnic disparities when it comes to socioeconomic determinants and barriers to accessing healthcare by dementia patients. Next, there are several socioeconomic determinants of cognitive decline and/or dementia. And we learned that there are even more barriers to accessing healthcare, with some present among patients, some among caregivers, some among healthcare providers and services, and some that are common among all of them. And last and most importantly, we learned that there's a lot you as a healthcare provider can do to mitigate your patients' socioeconomic risk factors and reduce their barriers to accessing healthcare, a lot of times simultaneously. Those are the references. And lastly, I just want to thank you so much for taking the time to learn more about how you can take better care of your patients. Thank you so much for doing that, and be sure to take great care of your patients and yourself. Thank you.